That tiny white spot on your thumbnail isn't calcium deficiency like everyone thinks. It's actually your body screaming a completely different warning. Most people ignore these nail signals until it's too late. What is your body really trying to tell you? Your fingernails are basically tiny time machines attached to your fingers. Seriously, while you're busy worrying about wrinkles and gray hair, your nails have been quietly documenting every health change happening inside your body for years. Most people think nails are just dead tissue that grows out of nowhere, but that's like saying your car's dashboard lights don't matter when the engine's having problems. Here's what nobody tells you about getting older. Your nail growth starts slowing down around age 25, and by the time you hit 60, they're growing about 50% slower than they did in your 20s. That shiny, smooth surface you had as a kid? Gone. Those nails start losing their natural shine and become thinner, almost like they're getting tired of doing their job. But here's where it gets interesting. Your nails can actually spot health problems before you feel a single symptom. Think about that for a second. While you're feeling perfectly fine, your nails might already be waving red flags about circulation issues, nutritional deficiencies, or even more serious conditions brewing beneath the surface. The ridges that start appearing aren't just cosmetic annoyances either. Those vertical lines running from your cuticle to the tip become more pronounced with each passing year. Some people spend fortunes trying to buff them away, not realizing they're essentially trying to erase evidence of natural aging. These ridges are like tree rings, marking time and telling stories about your body's journey. Small cracks begin developing naturally too. Your nails become more brittle because your body produces less of the oils and proteins that keep them flexible. It's not your fault, and it's not necessarily a sign you're doing anything wrong. Well, unless you're one of those people who uses their nails as tools for everything, from opening cans to scraping stickers off surfaces, then there's the circulation connection that most people completely miss. Poor blood flow doesn't just affect your hands and feet in obvious ways. Your nails depend on steady blood supply to grow properly and maintain their strength. When circulation slows down, which happens naturally as we age, your nails are among the first to show signs of distress. Nutritional problems also show up in your nails months before they cause other noticeable symptoms. Your body is surprisingly smart about rationing resources when supplies run low. Guess what gets cut from the budget first? That's right, your nails. They're not exactly essential for survival, so when your body needs to choose between keeping your heart running and maintaining perfect nails, the choice is pretty obvious. The weirdest part, all these changes happen so gradually that most people don't notice them until they look at old photos and realize their hands looked completely different 10 years ago. Your nails have been keeping a detailed health diary this whole time, and most of us never learned how to read it. What gets really fascinating is when you start noticing unusual colors creeping into your nails. Your fingernails just turned yellow overnight, and you're wondering if you should panic or book a spa appointment. Well, that yellow tint might be telling you more about your body than you'd expect. Most of the time, yellow nails happen because we're getting older. It's like gray hair, but for your fingertips. But here's where it gets interesting. Sometimes that yellow color is your body's way of waving a red flag. Diabetes can turn your nails yellow before you even know your blood sugar is acting up. Fungal infections love to crash the party too, especially as we age and our immune systems get a bit lazier. The weird part is that many people ignore yellow nails for months, thinking it's just nail polish stains or normal aging. Then there's the pale grayish nails that make your hands look like they belong in a vampire movie. These aren't just cosmetic issues, they're often your body's SOS signal. When your nails lose their pink healthy color and turn gray or pale, it usually means your blood isn't carrying enough oxygen or iron. Anemia is the usual suspect here, but liver problems can also drain the color right out of your nails. Makes sense, right? Your liver processes everything, so when it's struggling, your whole body shows it. But wait until you hear about the Neapolitan nail. Yes, like the ice cream. This bizarre condition shows up as 3 distinct color bands across your nail. White at the base, pink in the middle, and brown or red at the tip. Sounds made up, doesn't it? Yet 1 in 5 people over 65 develop this strange striped pattern. It's not dangerous, just another quirky sign that your body is changing with age. Let's not forget about those dark streaks that can appear out of nowhere. Most nail streaks are harmless, just melanin doing its thing as we age. However, sudden dark lines, especially single thick streaks, need attention fast. While rare, they can signal melanoma, the serious kind of skin cancer that doesn't mess around. And the weird part is how many people develop brownish nails and never connect it to their daily habits. Tobacco use leaves its mark on everything it touches, including your nails. Certain heart medications, antibiotics, and even anti-malarial drugs can turn your nails various shades of brown or blue-gray. Your pharmacist probably forgot to mention that side effect, right? The thing about nail discoloration is that it's like having a mood ring attached to your fingers, except instead of showing emotions, it's broadcasting your health status to anyone who looks closely. Your nails change color months before other symptoms show up because they're constantly growing and reflecting what's happening inside your body. What makes this even more fascinating is how your nails can predict health problems you don't even know you have yet. While you're busy worrying about wrinkles and joint pain, your nails are quietly documenting every nutritional deficiency and circulation problem. Speaking of circulation problems, that's just the beginning of what your nails reveal about your body's inner workings. Ever touched your grandmother's nails and wondered why they felt like tiny pieces of armor? That thickness isn't just random, it's your body sending signals about what's happening inside. Thick nails often scream poor blood circulation. When blood struggles to reach your nail beds, your nails compensate by growing thicker and harder. Diabetes makes this worse because high blood sugar damages those tiny blood vessels feeding your nails. The result? Nails that look like they belong on a rhinoceros rather than a human finger. But here's where it gets weird. While some nails thicken, others go the opposite direction and turn brittle as autumn leaves. Your skin loses moisture as you age, and guess what? Your nails are basically specialized skin. Less moisture means more cracking, splitting, and those annoying moments when your nail breaks just from opening a soda can. The culprit behind brittle nails isn't just age, it's physics. Your nails contain layers of keratin, the same protein in your hair. Think of it like a stack of paper. When young, those layers stick together perfectly. As you age, they start separating like pages in an old book. Makes sense, right? Then there are those vertical ridges that seem to appear overnight. Good news, they're mostly harmless. These ridges are like wrinkles for your nails, inevitable and universal. Everyone gets them, starting around age 25, but they become obvious after 50. It's your nail's way of saying, I've been working hard for decades. Well, not all ridges are created equal. Horizontal ridges tell a different story entirely. These can signal serious illness, malnutrition, or major stress your body experienced months ago. Your nails grow so slowly that they're like tree rings, recording your health history in real time. Splitting nails deserve special attention because they reveal something fascinating about aging. Your nail plate gets thinner over time while simultaneously becoming less flexible. It's like trying to bend a piece of old plastic. Eventually, it just snaps. This happens because your body produces less of the oils and proteins that keep nails supple. And the weird part is texture changes start way earlier than most people realize. At 25, your nails begin their slow transformation. The surface becomes slightly rougher, the shine starts fading, and tiny imperfections multiply. By 50, these changes become impossible to ignore. But why does this matter beyond vanity? Because your nails are windows into your circulatory system, your protein absorption, and your overall metabolic health. A nail that suddenly changes texture or thickness is worth investigating. Sometimes it's nothing, sometimes it's everything. The texture of your nails can even predict how well you'll age overall. Smooth, resilient nails often correlate with better circulation and nutrition absorption. Rough, constantly splitting nails might indicate your body is struggling with the basics of cellular repair and maintenance. Let's not forget that nail brittleness increases exponentially after menopause in women due to hormonal changes. Estrogen helps maintain nail flexibility, so when it drops, nails often follow suit. While texture tells important stories, sometimes nails don't just change texture, they change shape entirely. And that's where things get really interesting. You've probably heard the term clubbing and thought about dancing or baseball bats. Well, your nails can club too, and it's definitely not something you'd want to celebrate. Clubbing happens when your fingernails start curving downward and the tips of your fingers get swollen and bulgy. The nail bed becomes wider, and the angle between your nail and finger changes dramatically. Why does this happen? Your body is basically waving a red flag. Clubbing often signals serious problems with your lungs or heart. When these vital organs struggle to pump enough oxygen through your blood, your fingertips respond by swelling up. It's like your body's smoke detector going off, except the alarm is happening right at your fingertips. But here's where it gets tricky. Not every nail shape change means disaster is coming. As you age, your nails naturally lose some of their curve. That gentle arc you had in your 20s might flatten out a bit by your 60s. This is completely normal and happens to most people as they get older. Then there's something called transverse convexity, which sounds fancy, but simply means your nail beds get wider over time. Think of it like your nails are slowly spreading out across your fingertips. This becomes more common as people age and usually isn't cause for alarm. The real question is, how do you tell the difference between normal aging and something that needs attention? Speed matters here. Gradual changes over months or years are typically part of getting older. Sudden changes that happen over weeks should get you to a doctor's office pretty quickly. Let's not forget that major shape changes deserve professional eyes on them. If your nails suddenly start looking dramatically different from how they've always looked, that's worth investigating. Your doctor has seen enough nails to spot patterns you might miss. And the weird part is how subtle these changes can be at first. You might notice your wedding ring fits differently, or your gloves feel tight before you realize your fingertips are changing shape. Sometimes family members spot these changes before you do because they're looking at your hands from the outside. Here's something most people don't know. Nail shape changes can happen on just one hand or even one finger. If you've got clubbing on your right index finger but nowhere else, that could point to a specific circulation problem in that area. Your body is surprisingly specific about sending these signals. The timing of when you notice these changes matters too. Morning swelling that goes down during the day is different from permanent shape changes that stick around 24/7. Your nails are basically keeping a diary of what's happening inside your body, and learning to read that diary can be incredibly valuable. But shape changes are just one piece of a much bigger puzzle. While clubbing and unusual curves can signal serious health issues, there are other nail changes that connect even more directly to how well you're aging overall and what that might mean for your future health. Your nails are basically tiny windows into your entire body's aging process. Fast-growing nails, that's actually a sign you're aging well. Slow, sluggish growth means your body might be struggling with circulation or nutrition. The difference is dramatic. Your nails grow about 50% slower at age 70 compared to when you were 20. But here's where it gets really interesting. Terry's nails are one of the most telling signs doctors look for. These are nails that look white at the base, but have a pink or red band at the tip. They're named after a British doctor who first noticed them in patients with serious liver problems. The weird part, they show up in about 80% of people with cirrhosis, but also appear in heart failure and diabetes cases. Then there's the growth speed connection to longevity. People who live past 90 often have nails that grow faster than their peers. Scientists think it's linked to better blood flow and cellular regeneration. Your nail growth rate is like a speedometer for your overall health engine. Let's not forget how nail changes predict other health issues months before they become obvious. Kidney disease often shows up as pale, whitish nails long before you feel sick. Heart problems can cause clubbing miss, where your nails curve around swollen fingertips like tiny spoons. Lung disease does the same thing, but usually affects all 10 fingers at once. The texture changes tell their own story about longevity. Vertical ridges aren't just cosmetic annoyances. They reflect how well your body processes nutrients and maintains cellular repair. People with smooth nails at 60 usually have better bone density and skin elasticity than those with heavily ridged nails. Well, here's something most people don't know. Your nail health connects directly to your bone health. The same proteins that keep your nails strong also maintain your skeleton. Brittle nails often appear years before osteoporosis becomes detectable on scans. Makes sense, right? Both are made from similar building blocks, and the weird part is how quickly nail changes can happen when something goes wrong. A heart attack can create a horizontal ridge across all your nails within weeks. These are called Bowes lines, and they mark the exact timing of health crises like medical timestamps. Color changes work the same way. Yellow nails might just mean you're getting older, but they could also signal thyroid problems or diabetes developing. Gray nails often appear in people with circulation issues before they notice cold hands or feet. But why do some 80-year-olds have perfect nails while others struggle with thick, discolored ones? Diet plays a huge role. People who eat plenty of protein, biotin, and minerals tend to maintain healthier nails longer. Regular exercise helps too because it boosts circulation to your extremities. The bottom line, your nails are constantly broadcasting information about your internal health. Learning to read these signals gives you a head start on aging gracefully and catching problems early.